So now that you have your contact points and everything, now you want to make the matrix. So first thing you want to do is grab one of these trays, and you want to mark it where you're going to cut it. So since we're doing a provisional, an interim for 21, we want at least half the canine and half number 19. So I go like this, and I kind of look, okay, so here's half the canine, right here, and half of 19, which would be about here. Okay? And so I mark that, and it gives me an idea of where I should cut. So now take your straight handpiece and a Morse disc, and carefully, do not cut your finger, use the edge of this and cut. When you're done, you're going to have all this extra junk on it. So take the bluestone burr that we have in our kits, and we're going to smooth it out. It doesn't have to be super pretty, but you want all the edges free of all this stuff, and all the corners not to be sharp, because remember, this is what you're putting in a patient's mouth. Once you're done smoothing it out, we want to put at least one hole to make sure that you have like a reference point in case you want to take it off. So I'm going to take the small burr in our kit, and I'm going to come from the inside and drill out. Go slowly. You want to go slowly, because if not, then your burr's going to get stuck because it's going to melt all the plastic away. So go slowly. Just do a little bit at a time. Once you've gotten it to go through, just make sure the inside and the outside are smooth, and we're ready to use the Quicks putty. So you're going to take this and try it on and make sure it gets at least half the 19 and then half the canine, okay? And so what we're going to do is we're going to get our gun of Quicks putty, put on the tip, make sure if it's like a used tube, if there's any like dried up stuff in here, then just get rid of it. So we put on the tip, and we're going to dispense. So make sure you cover all of this. Keep your tip inside the putty, everything that you're dispensing, to prevent bubbles. So see, I'm filling up that space in between 19 and 21. And I'm keeping the tip inside the putty, and I'm filling up everything. Okay? So I have that. I'm going to pick up my tray. I'm going to fill this too. You don't have to fill it all the way because you have a bunch of stuff on the tooth, but at least get the sides, like all the sides and the bottom. Oops, sorry, you can't see that. See. Okay. So once you have that filled, you're going to seat it. So make sure you're aiming for half the canine and half the molar. Okay, so I'm going to let that sit. I'm going to let it set for 5 minutes. When you press it, you want to press it down pretty good, but don't press it down until you touch, because that means you're going to have like, the putty's going to be perforated, and then you're going to hit the tray, and it's just not going to be nice. So just set it down just enough, and then you just let it set for like 5 minutes. So it's been 5 minutes, and since you can like tell because you push in, it's kind of hard, so we're going to take this off. So the first thing I do is I cut off this little nub thing with a knife, and I take off this plastic thing, the tray. I take off the tray first because it just gives me a little more wiggle room so I can pull this. The thing is, sometimes when you pull this straight off, in between it rips. So if you're scared of your thing ripping, unscrew 19 and 21 and then pull out the teeth. So I'm just going to do that because I don't want to have to refilm this. And I'm going to pull this whole thing off, and hopefully the teeth come with it. So here are the teeth. I don't want any of the embrasures broken, so I'm going to pull these out really gently. Oh, I thought you did that. So see how it has a very nice like border? In a patient, you would cut this out so that you would get a little more room, a little more acrylic, a little more to work with. But again, like I said, ideal situation, so we're just going to leave it, okay? So we're going to trim up the tray, or trim up the putty. So I'm going to place it back on the tray using the hole as a reference point, and just put it in there. And I'm going to use my knife, and I'm going to cut away, making sure to leave at least half of the molar. Okay. Leaving half the molar, and leaving at least half of the canine. So if it's a little bigger than your tray, then that's fine. Just, you know, cut around it. So I'm going to cut and leave at least half of the canine. Okay? And then I'm going to clean up this part up here, because that way it'll help you seat it better. It'll help you seat it better, and that way your acrylic can, you know, your matrix can seat properly, and you won't have like a really high interim. So be careful, don't cut yourself, okay? So, and here's your matrix, and that's all you have to do for the matrix. Now you have a perfect matrix. It's going to make it really easy to do it.